Dr. Rutledge, as you have traveled throughout the world, and our association has been for more than about 15 years now, you have seen India, our system of practice, our hospitals, our operation theaters here. You have seen US, you have worked there, and rest of the world. So when it comes to comparison of safety of MGB and the aftercare, so where do we stand here in India as compared to the other Western countries?
Well, I don't think we can go by country. What we have to say is what we can see in the US, for example, is good surgery, bad surgery. What we can see is the American surgeons, the American Society of Surgeons said, we think the lap band is good. Okay?
Yeah.
Lap band's terrible.
Yeah.
And they had many people suffer from it.
Yeah.
Okay? We can say maybe, I don't know India everything, but maybe they can have good or bad here in India. The most important thing is I have seen your patients, I've seen you operate, I've watched you operate, and you provide excellent care. We talked about good MGB, bad MGB. You do a good MGB. You're meticulous, careful, low amount of bleeding, and low incidence of the problems of weight regain, reflux, bowel obstruction, bleeding, and things like that. Surgeon who does an operation in an expensive country doesn't mean automatically they have good results. I would say humbly that many of my colleagues in the US have very bad results according to what their patients say when they call me. So my opinion is your results are excellent, and we know that there are other surgeons in India with excellent results from MGB. But we also know a few in various countries with bad results from MGB. In the United States as well. And there are reports of bad outcomes. So the difference isn't the country, in my opinion, it's the surgeon and his skills and his commitment to the excellence in the care.
Yeah, I was asking this question because many patients are coming these days to India, as a part of medical tourism. In US it's not that easy.
But it's not a guarantee of having a good surgery in India or the US. It's the surgeon. And there are many good surgeons who don't understand the MGB. In other words, they think that the sleeve is a good idea and the Roux and Y is a good idea. And when they do the MGB, it's kind of like a sleeve Roux and Y with a little twist. And they result bad outcomes. And I've talked to their patients. So I have talked to patients of surgeons around the world. Many are good and many are not knowledgeable about the complications and how to perform it.
Right. Thank you.